Welcome to this episode of the Harpreet Singh Show. I'm your host Harpreet Singh from Surrey, British Columbia, Canada. In today's program, we collaborate with Cine and I have Dr. Arun Garg, my co-host, and we are having a special guest today, Dr. Lakshmi Y. Yatham. A very important topic, what we're going to focus on today. And before I come to the topic, I would like our guest to be introduced. So let's get Dr. Arun Garg to come forward and introduce our guest for today. Dr. Garg, good evening, and Dr. Yatham, good evening.
Good evening. So nice to be again with you.
Thank
And
you.
it's really a pleasure to be introducing our guest today. Our guest is a very special colleague. He and I have worked together on many times. He's a professor and head Department of Psychiatry, Faculty of Medicine, University of British Columbia. In addition, he is a regional head and regional program medical director for Vancouver Coastal, and he has been very active academically in research, over 300 peer-reviewed journal articles.
Mm-hmm.
He has played an active role in organizational psychiatry. He was president of World Federation of Societies for Biological Psychiatry. He is a researcher as well in Vancouver Coastal Research Institute and its head, director of Institute of Mental Health, and his interest in research has been in bipolar depression and other mental things. But today we are going to focus on mental wellness, mental health, South Asian population,
Mm-hmm.
and barriers and opportunities, and some of his work. So really excited and very warm welcome to my friend, colleague, Dr. Yatham.
Excellent. What a wonderful bio. Great. So, Dr. Yatham, we would like to start off with you, your journey. And as Dr. Garg has mentioned about you, that's a lot of things what you are doing. So, if you can just take us on the journey that as to when we talk about mental health issues, challenges, the crisis is there. What do you see in our community, especially?
Well, first of all, thank you, Arun, for that kind introduction, and Harpreet, thank you for inviting me to be on your show. Um, with mental health, as we all know, one in four people are affected by mental illnesses at some point in their lives, and I think the recent pandemic has had a further negative impact on mental health of the population around the world, not just in Canada, not just in British Columbia, but COVID has had negative impact on mental health on people around the world. And some of the studies which have looked at the stress levels in the population around the world have shown that 40% of people reporting experiencing stress during the pandemic time compared to 10%, which is what you typically say. So one can understand,
Mm-hmm.
the stress levels have gone up, and when stress levels go up, that can obviously have a negative impact on mental health for people around the world.
Mm-hmm.
Now, just looking at the South Asian community, of course, people in South Asian community are no different when it comes to experiencing mental health issues. One thing that might be slightly different for South Asian community is that there are probably uh, maybe more family support because still people tend to live together, nuclear families. Although that's a trend that's happening, maybe not as common as it might be in people from other types of background. But despite that, I think when it comes to looking at the serious mental illnesses, the proportion of people in South Asian communities that experience these illnesses, I would say, would be no different compared to those from other communities.
Mm-hmm. Right. Well, as you have mentioned, of course, the pandemic has had another strain of stress on us, but our daily life also, we are stressed out. We are working so much, we are busy, and that also does have an impact. And just for example, looking at yourself, Dr. Yatham, you run around so much, you are heading so many institutions. So, that's natural that stress does come. But right now, we are seeing a different kind of thing, even amongst youngsters also. This is having a toll. So, what do you feel? Why is it that we are finding, especially among the youngsters also, that they also seem to be stressed out, and mental health crisis is a major issue as far as youngsters are concerned?
Well, I think number of factors. I mean, one is that the awareness has increased about the mental health issues, right? I mean, we can talk about stigma, which probably was a bit more common in South Asian communities compared with the other communities. But I think in the last several years, the stigma has come down. Right, people are beginning to accept and are much more open and willing to disclose the mental health issues. So more people are talking about it. So that's one change, I think. The other issue that I would say is that prior to the pandemic, there was a lot of social interaction. All right, so whether it's work or school, you actually met with people, you socialized, you went for walks, uh, you did lots of physical activities. Much of that was curtailed during the pandemic, which has had a negative impact on mental health of people. Now that's changing, it's getting better, but still, I would say that a lot of people still seem to be using the virtual platforms like the Zoom and other social media platforms, and with young people, as you walk on the street, you might want to just sit down and observe some of the young people walking on the streets. Vast majority of them, as they're walking, they're actually looking at their smartphone.
Yeah.
They're not talking to each other;
Yeah.
just looking at their smartphone. You go to restaurants and you watch young people in terms of what they're doing. They're there, a bunch of them, and instead of talking to each other, a lot of the time they're just looking at their smartphone. So even though some of the things have changed because we are probably now, hopefully, at the tail end of the pandemic, this reliance on smartphones and the virtual media, are that's still sort of impacting that social interaction, I think, and of course, that can have a negative impact on mental health and resilience, right? So,
Right. Well, absolutely. Overindulgence in technology is having its toll, Dr. Garg, and it's just not the youngsters only. Even mid-aged also, or even elders also are now just busy with their own, technology, and interaction is getting less and less. Dr. Garg.
Yeah, so Lakshmi, couple of things which are of interest to us at Canada India Network Society, and that is considering the challenges we have. So, how to overcome the barriers? So, you talked about barrier of technology or social interaction, but and a stigma. So, I'm really pleased to hear that the notion of a stigma, which used to be huge in our community, especially for mental illness, is going down. However, this technology has now raised its head, and and everybody is less connected. So, do you have any observations as a leader in the community, as a practitioner, what we could do to improve that? And along with that, I am very interested in the integrative thinking of the total health, holistic thinking of body, mind, and intellect, and us connecting with our heritage. So I'd like to get your view on what you think those two are and what role they could play going forward, both in policy and in delivery.
Absolutely. A wonderful question, Dr. Garg. And Dr. Yatham, we'll go for a break. We'll be shortly back. And then, if you could address this wonderful question that has been raised by Dr. Garg, we'll be shortly back. So once again, welcome back. Dr. Arun Garg and Dr. Lakshmi Yatham are our guests today, and we are talking about mental health issues and the challenges as a communities that we are facing. So Dr. Yatham, before the break, Dr. Garg asked you this question. What do you have to say about that?
Yeah, so I guess if we're talking about South Asian communities within the lower mainland, um, one of the things that we've been concerned about is not having enough data to understand the mental health needs of the population, right? So that's been one of the issues. Although, there's some data from similar communities in other parts of the world, there hasn't been much research trying to understand, some of the things that we talked about, Arun, whether it is stigma or health-seeking behavior, or what kind of strategies people in South Asian communities that live in, let's say, Surrey, Abbotsford, in the region use in terms of promoting the resilience, getting support, those kinds of things. We don't have much data. So one of the things that we been doing in the last little while in partnership with Fraser Health is to see if we can actually recruit a clinician scientist psychiatrist whose focus might be in understanding those sorts of things from people that live in the Fraser Health region. So not necessarily just the South Asian community, because Fraser Health also has very diverse ethnic populations. So I'm actually very pleased to tell you that with the support from Royal Columbian Hospital Foundation and their CEO, Jeff Norris, and also Vivian Victoria Lee, who's the CEO for Fraser Health, and Anson Koo, who's the regional head for psychiatry for Fraser Health, we've been able to, with their support, find enough funding to to recruit for a clinician scientist psychiatrist. So we're hoping that person will be recruited within the next few months, and their research focus will be precisely to understand some of the questions that you raised. I can talk about generalities, but the goal, in fact, is to get much more specifics about their behavior, their care needs, their strategies that are being used to promote resilience and things like that. So that's going to happen in the very near future. So I'm very grateful to Royal Columbian Hospital Foundation and the Fraser CEO and their regional head as well.
Right. And what about
That's
the integrative
wonderful.
approach? What Dr. Garg talked about, that using the integrative approach to face this crisis, how useful can that be?
Oh, absolutely. So, I mean, I think it's very clear, those of us that have been practicing psychiatry for a number of years, that the medicines, the pharmacotherapy, is the foundation for management of a number of serious mental illnesses. But we've clearly recognized pharmacotherapy alone is not sufficient, right? It's necessary, but not sufficient to help people to fully recover and get back to their normal level of functioning. So you have to absolutely use other approaches to support treatment and care. And those include things ranging from exercise to education about the illnesses, to yoga, meditation, nutritional strategies. So I think all those things need to be considered as options for helping people with mental disorders. And I think that's not to say that every person needs all of those strategies. It varies from person to person. And that's where we have to talk about what we call a personalized treatment. So you assess each person, you look at what they have, and then take their educational as well as psychosocial background into account, and then develop a specific treatment plan that integrates some of these things. So in other words, the management plan has to be tailored to a specific person. It's not like we take everything and then offer the same thing to everybody. That doesn't work. You really have to understand the needs of each person and then tailor the treatment for that a person's individual needs.
Okay.
That's wonderful. The wonderful news, Lakshmi. I'm so happy to hear that after few years of hard work, that resource will be developed and that will provide opportunity. On that note, we've been working very hard. We have now established a 50-year legacy South Asian Health Fund within Royal Columbian Hospital, and we've been raising money so that will complement some of that work. And having people with a specific interest in this area will go long ways in building that capacity. So maybe in remaining time, we could talk a little bit about your perspective on the barriers which people face in our community. Do you see, like stigma used to be a big thing, but that might not be the case. But what are some of the other psychosocial barriers and biochemical barriers, or how you see uh, uh, any perspective on barriers which we could then work on to see if we could lower the burden?
Yes, so I would say, I mean, I think stigma is it's kind of improving, but it's not completely eliminated as yet, right? So, and I think there are a couple of areas where uh, you still see some challenges. So, for example, uh, someone who has a younger person who is manifesting, let's just say, unusual behavior, which is how people that are in the early phases of psychosis um, will manifest. And so the challenge always was going to be, how much would the family be willing to seek help for that young person, because there's always concern about what if the community gets to know that my son or my daughter has mental health issues. How is that going to affect number of their things, whether it's going to be finding a spouse or educational or work opportunities. So that's still there. I think that's an area that still needs to be addressed, I would say. I think the other aspect is recognition. So if someone is experiencing depression, which is very common, right? Uh, how depression presents in South Asia in people from South Asian communities may be slightly different, and some of the research that's been done in other parts of the world seem to suggest that they tend to have more physical types of symptoms. So again, there may be a delay in seeking treatment, thinking that, oh, I don't have a mental health issue. I have body aches or I'm tired, that kind of thing. So I don't need to see a psychiatrist. So that's another issue. And the third thing is, I think alcohol use disorder is fairly prevalent in South Asian communities. There again, recognizing when is it social drinking versus when does it become a problematic use, and when do you seek help, and how much is the family willing to push the family member. Your drinking is having impact on not only your career and function, but also on other friends and family members. Seek help. So that threshold may be different as well. So I think awareness and education are still quite critical, I think, in South Asian community. And I know a number of physicians in the community, including yourself, Arun, have been champions in this area, right? Running lots of educational sessions and disseminating knowledge to try and seek help. And this effort needs to continue, I think. And as I mentioned, when we recruit this new clinician scientist psychiatrist, we can hone in further in terms of specific issues, and perhaps then start developing clinical programs with support from Fraser Health Leadership try and address some of those barriers.
Well,
Excellent.
for sure, I mean, this show is not to promote some of the work we are doing, but this will fit in so well with some of the work we are doing at CINS or CINI, but more important, we have a specific South Asian Health Institute in Fraser Health, and we are putting a lot of energy in this area. So having a champion who has a focus in this area will go a long ways. So congratulations. I'm really delighted. This is wonderful news.
Great. Wonderful. So, with this wonderful news that we have heard, let's go for a short break. We'll be shortly back, and in the last segment, would like to learn a little bit more about, the coping mechanisms people adopt. Like you talked about alcohol, Dr. Yatham, but along with that, drug use is also on the rise, and that is having a great impact. So, what relation, mental health crisis is having with this? We'll just focus on this in the last segment. We're shortly coming back. Once again, welcome back to the program. ਅੱਜ ਦਾ ਇਹ ਪ੍ਰੋਗਰਾਮ ਤੁਹਾਡੇ ਤੱਕ ਪਹੁੰਚਾਇਆ ਜਾ ਰਿਹਾ ਹੈ AMC ਇੰਸ਼ੋਰੈਂਸ ਦੇ ਸਹਿਯੋਗ ਨਾਲ। ਜੇਕਰ ਤੁਸੀਂ ਹੋਮ, ਆਟੋ, ਟਰੈਵਲ, ਬਿਜ਼ਨਸ, ਲਾਈਫ ਜਾਂ ਰਿਕ੍ਰੀਏਸ਼ਨਲ ਇੰਸ਼ੋਰੈਂਸ ਲੈਣ ਦੀ ਸੋਚ ਰਹੇ ਹੋ ਤਾਂ ਇਹਨਾਂ ਦੀਆਂ 9 ਬ੍ਰਾਂਚਸ ਨੇ ਲੋਅਰ ਮੇਨਲੈਂਡ ਵਿੱਚ, ਜੋ ਕਿ ਹਫਤੇ ਦੇ 7 ਦਿਨ ਖੁੱਲ੍ਹੀਆਂ ਰਹਿੰਦੀਆਂ ਨੇ ਤੇ ਤੁਹਾਨੂੰ ਸਰਵ ਕਰਦੀਆਂ ਨੇ। ਹੋਰ ਜਾਣਕਾਰੀ ਲਈ ਕਾਲ ਕਰ ਸਕਦੇ ਹੋ 6045076666 604 507 6666। ਸਾਡੇ ਅਗਲੇ ਸਹਿਯੋਗੀ ਹਨ ਅਗਨੀਹੋਤਰੀ ਇਮੀਗ੍ਰੇਸ਼ਨ। ਟੈਂਪਰੇਰੀ ਸਟੇਟਸ PR, ਨਵੇਂ ਹੋ ਕੈਨੇਡਾ ਵਿੱਚ, ਕੈਨੇਡਾ ਆਉਣਾ ਚਾਹੁੰਦੇ ਹੋ ਜਾਂ ਕੋਈ ਵੀ ਇਮੀਗ੍ਰੇਸ਼ਨ ਸੰਬੰਧੀ ਗੱਲਬਾਤ ਕਰਨੀ ਹੈ ਤਾਂ ਤੁਹਾਡੀ ਮਦਦ ਕਰ ਸਕਦੇ ਨੇ ਨੀਰਾ ਅਗਨੀਹੋਤਰੀ। 2006 ਤੋਂ ਸਰਟੀਫਾਈਡ ਇਮੀਗ੍ਰੇਸ਼ਨ ਕੰਸਲਟੈਂਟ ਵਜੋਂ ਇਹ ਕੰਮ ਕਰ ਰਹੇ ਨੇ। ਤੁਹਾਨੂੰ ਓਨੈਸਟ ਤੇ ਰਿਲਾਇਬਲ ਇਨਫੋਰਮੇਸ਼ਨ ਦੇਣ ਦਾ ਵਾਅਦਾ ਕਰਦੇ ਨੇ। ਹੋਰ ਜਾਣਕਾਰੀ ਲਈ ਕਾਲ ਕਰੋ 6045972284। ਅੱਜ ਸਾਡੇ ਮਹਿਮਾਨ ਨੇ ਡਾਕਟਰ ਅਰੁਣ ਗਰਗ ਅਤੇ ਨਾਲ ਡਾਕਟਰ ਲక్ష్ਮੀ ਯਾਤਮ, ਅਤੇ ਗੱਲਬਾਤ ਚੱਲ ਰਹੀ ਹੈ ਮੈਂਟਲ ਹੈਲਥ ਇਸ਼ੂਜ਼ ਜਿਹੜੇ ਸਾਡੇ ਨਾ ਸਿਰਫ ਆਪਣੀ ਕਮਿਊਨਿਟੀ ਵਿੱਚ ਬਟ ਓਵਰਆਲ ਸੁਸਾਇਟੀ 'ਚ ਅਸੀਂ ਦੇਖ ਰਹੇ ਹਾਂ, ਉਸ ਵਿੱਚ ਕਿਹੜੀਆਂ ਕਮੀਆਂ ਨੇ, ਜਿਹੜਾ ਸਟਿਗਮਾ ਦੀ ਗੱਲ ਚੱਲ ਰਹੀ ਹੈ ਜਾਂ ਜਿਹੜੇ ਕੋਪਿੰਗ ਮੈਕੈਨਿਜ਼ਮਸ ਅਸੀਂ ਅਡਾਪਟ ਕਰਦੇ ਹਾਂ ਉਹਦਾ ਕੀ ਨੁਕਸਾਨ ਸਾਨੂੰ ਹੋ ਰਿਹਾ। ਸੋ ਲੈਟਸ ਗੈਟ ਬੈਕ ਟੂ ਆਰ ਗੈਸਟ ਐਂਡ ਕੰਟੀਨਿਊ ਆਰ ਡਿਸਕਸ਼ਨ. So, Dr. Yatham, my concern about drug use and mental health crisis, from what angle do you look at it, and what is a matter of concern which we need to be concerned and we need to work on that?
So I think again it just depends on which part of the province that you look at. Obviously, I'm sure you've been hearing a lot in the media about the opioid crisis, which has been which has had a major impact in terms of its toll on young people. Like a lot of people dying with fentanyl overdose, and that's been a major concern. And some of it has to do with contaminated drug supply and related to the potency of the street fentanyl that's been sold, which kind of varies a great deal, and depending on what you end up getting and taking. It could be very toxic and can lead to fatal overdose and death, and that's been a huge challenge. We're also seeing a rise in stimulant use as well, and that's obviously a concern. The methamphetamines, cocaine, and some of the other stimulant medications, so that's been an issue. Alcohol is something that people don't talk about. But in fact, if you actually look at what's the most common substance use presentation to our emergency departments, it's actually alcohol use disorder. So we have many more people presenting with that than, for example, stimulant use and things like that. So these are still significant concerns. And as you may have heard, the ministry has been trying to come up with various strategies to address the substance use issues, stimulant and opioid crisis. They're trying to provide more funding to health authorities to address these barriers. I think what we need to look at, I think, as a health authorities, is that start thinking about a more comprehensive spectrum of services for people with substance use issues, right? Because again, like everything else in life, there's no one size that fits all. Because there may be people who have gone way too far in terms of the substance use disorder, the focus may have to be just harm reduction, right? You want to make sure that they don't use street needles and street drugs, and we provide access to substances. But there are other people who may be starting out and on other stages of that spectrum who might actually benefit from a recovery oriented approach,
Right.
obsolete oriented approach. So I think we really need to think about spectrum of, we need to look at what services we have within each health authority, where are the gaps, and can we plug those gaps so that each health authority offers a wide spectrum of services so that everyone that has a substance use problem, whether it's a mild, moderate, or severe, um, based on their individual needs, we can tailor the treatment or management approaches. And that's one of the challenges within the system, because at the moment, I don't think, we have that spectrum of services.
Okay. And Dr. Yatham, what impact does our lifestyle have on our mental health?
Well, in quite a significant way, because as we all agree, there are the living in this modern society comes with a certain amount of stress, right? Regardless of where you work, what you do, there's an element of stress. Um, so I think we all need to figure out a way to develop strategies to minimize stress in our lives and come up with the strategies that minimize the impact of stress, because uh, it's probably not possible to completely eliminate stress in one's life, because you're just interacting with people in the society and working, and so there's going to be some stress that's part of our lives. So I think people really need to look at what are some of the things that they can do to minimize, and those might be things ranging from socializing, going for walks, exercise, yoga, meditation, listening to music, going for a jog. There's multiple things that one can do, and I think the trick is to choose activities that you're likely to persist with, because I think often, most of us start setting these incredibly ambitious goals, uh, and we don't follow. So if you're someone who likes swimming, by all means use that as a mode of exercise. If you're someone who likes jogging or cycling, do that. Or if you enjoy walking, do that. If you enjoy walking and you want to, go on a treadmill or go for swimming, something that you don't enjoy, then don't pursue that, because you're not going to be able to sustain it. So I think the trick is you got to have those um, strategies incorporated, but try and choose the ones that you actually like, so that you're much more likely to persist with them.
Okay, Dr. Garg?
Yeah, no, that's a wonderful advice in terms of. Now, one thing you didn't mention in your lifestyle, and I wondered, does it play a role? How about the food? The food you eat. Are there any recommendations or observations on the food and its role in mental wellness?
Yeah, absolutely. I mean, I think there's a lot of research that's being done now to look at, in fact, whether diet changes actually uh, can be therapeutic. For example, for some types of mental disorders, and there are some studies that suggest a Mediterranean diet might actually be helpful for people, that are experiencing depressive symptoms. So I think it's still in early stages, but it's very clear that there are some diets that can be pro inflammatory. So, for example, the ones that the fast foods, for example, the ones that cause rapid rise in blood sugars, can cause inflammation in the body, which can have negative effects not only in terms of the brain health and mental health, but also even in terms of physical health, right? So I think one needs to be watchful about that. making sure that you incorporate things like the vegetables and the protein into your diet, minimize the intake of fast food, and not have too much intake in terms of sweetened drinks, for example. So clearly, I think diet uh, type of food that you eat has an impact on one's health. There's absolutely no question about it.
Okay,
Wonderful. Well,
great.
thank you.
And Dr. Yatham, you talked about from your talk, I can understand, every person is unique and you should be proud of your uniqueness and you should accordingly live your life. But in this age of social media where we are trying to fit in, are there any studies which point out to this fact that how social media is impacting our mental health? What would you like to say about that?
I think there's obviously a societal pressure to conform to societal norms and standards, right? So that's always an issue in terms of, because there are expectations in terms of how you should be dressed or how you should interact, and those kinds of things. Yes, one needs to respect social norms, but at the same time, you also can incorporate your own individuality into that as well. And when I talk about the individual needs again, I think it's really looking at when someone has a mental disorder, what um, what should the management of that individual or the treatment plan should include. And I think what I was trying to say is that that treatment plan needs to be tailored based on that person's needs. Right. So two different things. I think one is when we're treating someone with a mental disorder, it's got to be what we call a personalized treatment. And the term that people use these days is personalized medicine or precision medicine.
Right.
The thing that you're talking about, Harpreet, is how do we live in this society, uh, um, ensuring that we still stick to our individual values and culture, those kinds of things, while also respecting some of the societal norms and the boundaries and expectations. I think there's always going to be some tension. Uh, but I think the key to focus on is, as long as you practice some of those other strategies that sort of minimize stress in one's life, and um, remembering that when you express your own individual um, opinions and views and that kind of thing, it's making sure that it doesn't put someone else at discomfort,
Right.
right? Because I think you got to make sure that you achieve that balance. You
Absolutely.
have as much right to live and express your views as someone else out there as well. So you got to make sure that you're not violating someone else's boundaries, so you're not hurtful to someone else, right? So I think that's important to remember as
Very
well.
true. Absolutely. In conclusion, Dr. Garg, anything you have, any question or
Yeah,
anything?
no, I think your last observation, Lakshmi, is just bang on. As a biochemist, bearing my head as a biochemist, I think this biochemical individuality, it really is the core of future. And this is where Vedic sciences have been way ahead. And we are very excited in our part of work how role of individuality in Vedic science plays out. So Vedic science describes the individual based on their qualities. And I think that has been missing from practice. So I think your observation is bang on, that the balance between the individual and then living within the society. These are very exciting times. And I think what you have to say really is very critical for health of society. So I personally thank you for your time and sharing some of that words of wisdom, and we look forward working further with you how we could make our community healthier. So thank you.
Absolutely. Absolutely. And before I let you go, Dr. Yatham, resources which are available, because today there are a lot of things which many time people don't use, which are available to them. Would you like to comment on this as to the different type of resources which people can have access to?
Yeah, so I think one of the challenges is, people often look to the internet, right? And I think one has to remember that the information that's available on the internet isn't necessarily what we call peer reviewed or scientifically vetted, right? So because anyone can put information on the internet and express their views, and so I think as one looks for resources, I would say make sure you look for resources that are put up by well-established organizations. I think the first step might be to look at health authority resources. Those will have information that's clearly vetted and evidence-based. We also have a Mind Health BC site that we had started a number of years ago, which also
Okay.
provides resources in terms of navigating how to get help, resources for people that experience depression and other types of mental disorders. So Mind Health BC website is something that's worth looking at. Other health authorities, including PHSA, Fraser Health, and Vancouver Coastal, and other health authorities, also have their websites which have curated information about resources available for people with mental health issues. So I think, but the most important message I think is, when you look for a resource or information, make sure that it is provided by an organization that's reputable.
Absolutely.
Like Canadian Mental Health Association.
Well, absolutely.
Otherwise, you could get information that may not be right. So you
Very
got to
true.
be careful.
Well, you have hit the nail in the head. Absolutely, that is the most essential thing, because today on the net there are a lot of things which people just try to follow, which can be detrimental to the interest. But if it is from a reputable organization, definitely people should look into that and take advantage of that. Dr. Yatham and Dr. Garg, it was a pleasure talking to you both. Thank you very much for your time, and hopefully in future we talk more in details about specific issues. Thank you very much.
My pleasure. Thank you both for inviting me to be on the show.
Thank you.
Yeah,
Thank you, Dr. Garg.
Thank you.
Bye-bye.
Yeah, thank you.
ਸੋ ਇਹ ਸਨ ਸਾਡੇ ਅੱਜ ਦੇ ਮਹਿਮਾਨ ਡਾਕਟਰ ਅਰਨ ਗਰਗ, ਕੈਨੇਡਾ ਇੰਡੀਅਨ ਨੈਟਵਰਕ ਸੁਸਾਇਟੀ ਤੋਂ, ਤੇ ਨਾਲ ਡਾਕਟਰ ਯਾਥਮ, ਜਿਹੜੇ ਲక్ష్ਮੀ ਯਾਥਮ। ਇਹ ਮੈਂਟਲ ਹੈਲਥ ਦੇ ਉੱਤੇ ਜੋ ਅਸੀਂ ਗੱਲਬਾਤ ਕੀਤੀ, ਬੜੀ ਸਿੰਪਲ ਗੱਲਾਂ ਇਹਨਾਂ ਨੇ ਕੀਤੀਆਂ ਨੇ। ਸਿੰਪਲ ਲਿਵਿੰਗ, ਹਾਈ ਥਿੰਕਿੰਗ, ਬੈਕ ਟੂ ਆਰ ਰੂਟਸ, ਆਪਣੀ ਜ਼ਿੰਦਗੀ ਵਿੱਚ ਸਟ੍ਰੈਸ ਜਿਹੜਾ ਹੈਗਾ ਉਸ ਨੂੰ ਘਟਾਉਣ ਲਈ ਇੰਟੀਗ੍ਰੇਟਿਵ ਅਪਰੋਚ ਵੀ ਅਡਾਪਟ ਕੀਤੀ ਜਾਏ, ਬਟ ਆਫ ਕੋਰਸ ਜਿਹੜੇ ਰਿਸੋਰਸਿਸ ਹੈਗੇ ਨੇ ਉਹ ਸਹੀ ਥਾਂ ਤੋਂ ਲਏ ਜਾਣ। ਅੱਜ ਅਸੀਂ ਭੱਜਦੇ ਹਾਂ ਅਤੇ ਬਹੁਤ ਕੁਝ ਸਿੱਖਣ ਦਾ ਯਤਨ ਕਰਦੇ ਹੈਗੇ ਹਾਂ, ਪਰ ਕਈ ਵਾਰ ਉਹ ਸਾਡੇ ਇੰਟਰਸਟ ਵਿੱਚ ਨਹੀਂ ਜਾਂਦਾ। ਸੋ ਇਸ ਕਰਕੇ ਇਹ ਜ਼ਰੂਰ ਯਕੀਨੀ ਬਣਾਓ ਕਿ ਜਿਹੜਾ ਤੁਸੀਂ ਰਿਸੋਰਸ ਲੈ ਰਹੇ ਹੋ ਕਿੱਥੋਂ ਆ ਰਿਹਾ, ਕੀ ਉਹ ਰਿਪਿਊਟਡ ਹੈ ਕਿ ਨਹੀਂ ਹੈਗਾ। ਉਸ ਤੋਂ ਇਲਾਵਾ ਜ਼ਿੰਦਗੀ ਦੇ ਵਿੱਚ ਐਂਗਜ਼ਾਇਟੀ, ਡਿਪਰੈਸ਼ਨ, ਟੈਨਸ਼ਨ ਇਹ ਇਸੇ ਤਰੀਕੇ ਨਾਲ ਹੀ ਰਹੇਗੀ ਜੇਕਰ ਅਸੀਂ ਆਪਣੇ ਲਾਈਫ ਸਟਾਈਲ ਦੇ ਵਿੱਚ ਕੁਝ ਮੋਡੀਫਿਕੇਸ਼ਨਸ ਨਹੀਂ ਕਰਦੇ। ਸਾਡਾ ਖਾਣ ਪੀਣ, ਐਲਕੋਹਲ ਦਾ ਇਹਨਾਂ ਨੇ ਜ਼ਿਕਰ ਕੀਤਾ, ਬਹੁਤ ਜ਼ਿਆਦਾ ਇਸ ਦਾ ਇੰਪੈਕਟ ਪੈਂਦਾ ਹੈ, ਬਟ ਕੋਪਿੰਗ ਮੈਕੈਨਿਜ਼ਮ ਜਿਹੜੇ ਇਸ ਇਸਤੇਮਾਲ ਕਰ ਰਹੇ ਨੇ ਇਹ ਨਾ ਹੋਏ ਕਿ ਉਹਦਾ ਸਾਨੂੰ ਨੁਕਸਾਨ ਹੋ ਜਾਏ। ਸੋ ਇਹ ਚੀਜ਼ਾਂ ਵੱਲ ਜੇਕਰ ਅਸੀਂ ਧਿਆਨ ਦਿਆਂਗੇ ਤਾਂ ਡੈਫੀਨੇਟਲੀ ਅਸੀਂ ਆਪਣੀ ਮਾਨਸਿਕ ਸਿਹਤ ਨੂੰ ਠੀਕ ਰੱਖ ਸਕਦੇ ਹਾਂ। ਡਾਕਟਰ ਸਾਹਿਬ ਨੇ ਜਿਹੜੀ ਰਿਸੋਰਸਿਸ ਦੇ ਬਾਰੇ ਗੱਲ ਕਹੀ ਅਖੀਰ ਦੇ ਵਿੱਚ, ਉਹ ਤੁਸੀਂ ਜਾ ਕੇ ਉੱਥੋਂ ਸਾਰੀ ਇਨਫੋਰਮੇਸ਼ਨ ਲੈ ਸਕਦੇ ਹੋ। Thank you very much for sparing your valuable time and being a part of this program. You can contact me at 604-603-7555, or you can email me at harpreetsingshow@gmail.com. If you have any topic in mind, if you also want to be a part of this program, you're most welcome to, because the purpose of this program is to educate, inspire and empower our community. So most welcome, you can get hold of me anytime. ਇੱਥੇ ਲੈਣੇ ਜੀ ਅੱਜ ਦੇ ਇਸ ਪ੍ਰੋਗਰਾਮ ਦੀ ਸਮਾਪਤੀ ਕਰਨ ਦੀ ਆਗਿਆ। ਫਿਰ ਮੁਲਾਕਾਤ ਕਰਾਂਗੇ। ਹੈਵ ਅ ਸੇਫ ਈਵਨਿੰਗ, ਸਟੇ ਹੈਲਦੀ ਐਂਡ enjoy yourself.